Lisa with justorthopedic.com, and we are thrilled to be here on location at Pine Creek Medical Center in Dallas, located just north of UT Southwestern on Harry Hines Boulevard. And I have the pleasure of sitting across from Dr. Nilpesh Patel with Lakewood Orthopedics and Sports Medicine. Are you doing okay today?
I am. How about you?
I'm doing great, and it's good to see you again from our last visit.
You too.
Today we're going to be talking about ruptured ligaments. Can you just, in very general terms, tell us what a ruptured ligament is?
So ligaments connect bone to bone. They stabilize joints and allow us to move our joints very smoothly. A ruptured ligament is when you have an injury to these ligaments. These ruptures can be partial, complete, or even just a stretching of the ligament fibers. We usually grade ligament injuries. Grade 1 is just a stretching, while grade 2 is a partial rupture. Grade 3 is typically a complete rupture. From a standpoint of an orthopedic surgeon, when a patient has an injury and comes to visit us for a ligament injury, we, number one, look at what joint is injured. Number two, talk to the patient and find out what kind of activities they're involved in and what actually caused the ligament injury. And number three, actually examine the patient and figure out if there is joint instability or not. And depending on that, we can gear our treatment. So ligament injuries are very common. We see them every day. And so it's very important that we figure out which ones are causing instability, which one are causing issues with patient activity. And there are many ways that we can then treat these, whether it be bracing, rehabilitation, or surgery.
So why don't you give us a very specific example of a patient that you treated and what the injury was and how you actually treated them?
So I deal more with the upper extremity, and so I see a lot of ligament injuries in the hand. One of the most common ligament injuries in the hand is related to sports, and that involves a ligament that stabilizes the thumb. Sometimes it's called gamekeeper's thumb, and a lot of goalies will get this injury as they're reaching for a ball or diving for a ball. And this ligament here in the thumb is very important in terms of gripping and providing stability to your hand. And when this ligament is injured, the patient can get pain, swelling, and significant instability at times. So I've seen a patient who's had this while playing soccer, and when they saw me, I examined them. Obviously, they were a soccer player. The hand and the thumb was important to them. And when I examined them, I always examine the other side and see if there is a difference in the way that joint is moving or a difference in the stability. And in this particular patient, there was instability. And when there is obvious instability and an injury that kind of matches that instability, really your option at that point for this patient was a surgery to fix that ligament. Now that's not the case in all patients. So some patients do have, like we talked about, grade 1 injuries or grade 2 injuries where there is very mild instability or just a stretch of the fibers. And in those patients, we don't necessarily jump to surgery. So we will try bracing, followed by rehabilitation, and then followed by getting the patient back to activity. So there are different treatments for different type of ligament injuries, and it's important to get evaluated and so that you know if you are treating this properly and getting back into your activity as soon as you can.
Well, it is unfortunate that so many people have these types of injuries, but great news for them that there's so many wonderful treatment options for them to repair those ligaments.
Yes, ligaments are every day part of our life, and we injure them all the time, so there are many options. So make sure you go and get those ligament injuries checked out.
Great information. Again, this is Dr. Nilpesh Patel with Lakewood Orthopedics and Sports Medicine. I'm Elisa with justorthopedic.com. Please follow us on Facebook, LinkedIn, and Twitter.